Good afternoon, everyone. Parking is a challenge, and I understand the traffic in Oakland is similarly a challenge. But we won't wait because this is a special event. I'm Maureen Lichtveld, the Dean of the School of Public Health at our University of Pittsburgh, and I'm welcoming you to one of our cornerstone events for our 75th anniversary, the unveiling of the Salk exhibit. There is an old Chinese proverb that goes like this: it's important to learn from the past, to prosper in the present, and anticipate the future. And that's what we're doing today. Not only through the panel that you're about to enjoy, but also through the excellence of research, education, and practice that our school generates and trains all of our health professionals and partners with our community. We just talked about public health, both locally and globally, as we prevent disease and achieve health equity. Our school was founded, if you count backwards, in 1948. And this cornerstone event is one of many events over the entire year. We're particularly privileged to partner with the Salk family, and we're so honored to have the Salk Legacy exhibit here as part of our 75th anniversary. But we couldn't do it without recognizing not only Jonas Salk, but the honor to have Dr. Peter Salk, not only on our faculty, but in our midst. Thank you, Peter. Today, as we unveil this free public health exhibit of historical laboratory equipment that you'll see outside, documents and photographs that you'll see outside and upstairs, as we celebrate this world first polio vaccine, we celebrated right here in Pittsburgh. How awesome is that? So you'll see materials on display of the exhibit. You'll see more in the library. And please, Dr. Galloway, where are you? Thank you so much for joining us. We're also joined by our audience live stream to celebrate this legacy. Before we move on, I want to recognize the director of the Pitt Center for Vaccine Research, Dr. Paul Dupree. Paul, where are you? Paul is the Jonas Salk Chair of Vaccine Research, and I am so honored to be the Jonas Salk Chair of Population Research. But you're not here to listen to me. You're really here to hear introductory remarks from our Chancellor, Dr. Pat Gallagher. Please, Pat.
Well, it's great to see you all. This has been a long time coming. And Maureen, let me just correct you on one thing. They're not here to hear me either. They're here to hear this amazing panel. You know, it's an amazing thing when you think what happens at a university each and every day. This university has had some remarkable moments in its history. And you might think of Langley and the race that ultimately resulted in manned space flight, you know, something with Pitt and Pittsburgh ties. Tom Starzl and the whole field of transplantation. But I think, in my view, the most significant event was the work of Jonas Salk. Not only was this a remarkable feat 70 years ago now, where he and his team of Pitt researchers developed the first polio vaccine, but it was one of the epical moments in science, showing that knowledge and science could be put to such dramatic use against such a profound need. And I think that it launched not only, you know, the cure for polio, but it launched many thousands of scientists who saw that vision and that promise and sought to ignite, you know, their enthusiasm, much like the Apollo program in the post-Sputnik area ignited that same fervor for science. So it was really, truly one of the great achievements of the 20th century. And the announcement that this vaccine was safe, effective, and potent. And this is just for those of you working on the vaccines recently, just kind of happened, but maybe not the same way, catalyzed spontaneous celebrations and the ringing of church bells across the country. And our Cathedral of Learning itself hosted a mass vaccination effort with thousands of people across the community, and faculty, students, and staff lining up for their polio vaccination. Well, history does sometimes, it may not repeat itself, but as someone said, it does rhyme. And 2 years ago, once again, on Pitt's campus, we saw mass vaccination clinics for Pittsburghers and our own community here on campus, including at the Peterson Event Center. And the infectious disease experts in the room don't need me to tell them of this rhyming with the past. We all understand the importance of these seminal achievements, but also the importance of recognizing and celebrating them for what they are. And that's what we're here for today. Peter, I want to start by thanking you. Peter has been a steady, gentle, but firm reminder to Don and I of the importance of doing this work, and more than that, making it happen. So for your thoughtful and generous selecting of the artifacts, both scientific and family, and making this legacy exhibit what it is, Peter, just thank you so much for what you've done. I want to thank all of our panelists here today for your roles, Chris. The Gates Foundation, you've played a pivotal role in partnering with us to maximize the power of our research. Ali Khan from another former federal official, I guess, like myself, long and important voice in the public health preparedness and response as we talk about how vaccines fit into the broader response to epidemic and pandemic diseases. And Stephanie, to you and the Rotary International for carrying on the work of Jonas Salk to this very day. Leading the global campaign now to eradicate polio from the areas where it still remains endemic. And so we thank you and Rotary International for all the vital work that's going on. And last but not least, in the spiffy tie, Don Burke, our own distinguished public health professor and emeritus dean of the public health school here, modeling his data as only Don can do. But again, not only with his own remarkable experience in this area, Don, but again, as a champion and leader of this, it was one of the first things I heard about when I showed up to campus 9 years ago. It's worth remembering that the Salk vaccine effort was a complex, national, comprehensive effort, full of uncertainty and risk. And it was in the early days of modern biomedical science. It was a pioneering moment. And I'm delighted that we paused to celebrate that history because that collective spirit remains with us. And I think it's demonstrated through this panel today. Maureen, under your leadership and of our school, thank you for bringing together all of the deep expertise that's needed to solve these critical problems, including with Paul and our Center for Vaccine Research. I'm going to apologize ahead of time, and it's commencement weekend, and I'm a little bit overbooked. So with apologies in advance, let me just extend my best wishes to all of you, and thank you for being here, and I hope you enjoyed the exhibit. And please now turn your attention to our panelists. Thank you.
And he's gone before I can thank him, but thank you, Chancellor Gallagher. You know, there are many ways that we are fortunate. One of those ways is one of my principles in life, and that's growing the public health workforce. And so it is with extreme pride that I introduce to you the future of public health, Afifa Libowitz and Ilya, I knew I was going to mess this up, Ilya Oshodi, to tell us about this panel. Afifa and Ilya.
Hello, my name is Khaviva Lebovitz, and Ali and I will very briefly introduce each one of our panelists. You can read more about them after in your program. Each of the panelists will present for approximately 5 minutes on a key element of the Salk legacy, polio eradication, and global infectious diseases. After that, Dean Lichtfeld will moderate a discussion before opening it up for questions from the audience. Don Burke is Dean Emeritus and Distinguished University Professor of Health Science and Policy here at the University of Pittsburgh School of Public Health. Over the span of his career at Walter Reed, Johns Hopkins, and Pitt, he has led epidemiology and vaccine programs from the bench to the bush in Thailand, in the Cameroon jungles, and numerous other locations worldwide. Chris Elias is the president of the Global Development Division at the Bill and Melinda Gates Foundation, where he leads the foundation's efforts aimed at finding creative new ways to ensure solutions and products get into the hands of people in lower and middle-class income countries who need them most. Among his many responsibilities, he is chair of the board for the Global Polio Eradication Initiative. Ali Khan is a retired assistant surgeon general and current dean of the University of Nebraska Medical Center College of Public Health. Previously, he served at the U.S. Centers for Disease Control and Prevention for 23 years before retiring as the director of the Office of Public Health Preparedness and Response, where he was one of the main architects of the CDC's Bioterrorism Preparedness Program. He was also deeply engaged in the CDC's polio eradication activity.
Hello, my name is Aaliyah Oshodi, and I'll continue with the introductions. Maureen Litchfield is Dean of the University of Pittsburgh School of Public Health. She also serves as Professor of Environmental and Occupational Health and is the Jonas Salk Professor of Population Health. Before joining Pitt, Dr. Litchfield chaired Tulane University's Department of Environmental Health Sciences. Prior to her role at Tulane, she served for nearly 2 decades with the U.S. Centers for Disease Control and Prevention and the U.S. Department of Health and Human Services Agency for Toxic Substances and Disease Registry. Peter Salk is president of the Jonas Salk Legacy Foundation in La Jolla, California, and is a professor in the Department of Infectious Diseases and Microbiology at Pitt Public Health. His current activities include educating the public about his father's life and work, exploring approaches to reduce the severity of various public health problems, and improving prospects for a more sustainable future for the world. Stephanie Yurchik is the incoming president of Rotary International. She is partner and chief operating officer of Doctors at Work, a consulting and training company. A Rotary member since 1991, Dr. Yurchik has traveled to Vietnam to help build a primary school and to the Dominican Republic to install water filters. She has served Rotary in many roles, including as a director, trustee, and chair of strategic planning. I now invite Dr. Donald Burke to the podium. He will start us off by providing some history about Jonas Salk's work here in Pittsburgh, and the other panelists will connect our past to the present and to our future.
Okay. That's me. I first met Dr. Jonas Salk when I was at the Walter Reed Army Institute of Research as an infectious disease research physician working on vaccines. And for a while, we had a collaboration on HIV vaccine. So it was a special privilege and honor for me when I came to Pitt to become the Jonas Salk Chair of Global. It was also an honor to then meet his son, Peter, who I met when I became established as the chair. And we had discussions about the importance of the legacy of Jonas Salk. And we traveled to San Diego to look at the archives there. And here's a picture of us talking about the possibilities of bringing this to Pittsburgh. Let me go through just a sort of a quick rundown of the important historical points for the development of the polio vaccine here at Pitt. Dr. Salk was recruited here in 1947. He had been working on influenza and switched his research from influenza to polio. What that meant was that he started to collect polio strains from patients at Municipal Hospital right up the hill. He developed cell culture methods to grow the poliovirus, developed antibody assays to measure its ability, antibodies to kill the virus. He did virus strain typing to show that there were 3 types of polio that led to the realization that the vaccine needed 3 separate components, one for each type. He did virus inactivation methods to find ways to kill the virus, ended up with formaldehyde, and did vaccine studies in monkeys to prove that the vaccine would work. All of those were done in a few years. And then in 1953, he began the Salk vaccine studies in humans here in Pittsburgh. The first human trials were done to the west of here at the Watson home, and then to the north at the Polk School. He expanded his early trials in lab workers and families, and there's a photo of Peter getting his immunization. Then that went on to include elementary school students here in the Pittsburgh region. Everybody knows about the big 1.8 million person trial, the polio vaccine trial. But there was a critical step between the early trials and expanding those so that we could be sure that they were safe and stimulated immunity. And at that time, there were about 7,500 school students here in Pittsburgh who their parents volunteered to participate in the trial. The persons who in the national trial that came later were known as the polio pioneers. They all got the famous buttons and the like. But I like to think of these people, these kids, first, second, and third graders, as the pre-polio pioneers. They were the ones who even came before the pioneers. And so we should, and we should really be proud of that. In 1954 then, based on the data that came out of Pittsburgh, that was the beginning of the National Foundation for Infantile Paralysis led the trial. There were 1.8 million polio pioneers who participated in that trial. Amazing. It was done in essentially all states of the Union, 300,000 volunteers, including nurses, doctors, teachers, all of whom made this trial possible. And then the wondrous conclusion that, yes, the vaccine worked and it protected against paralytic polio and the more severe forms of polio with a very high level of efficacy and good safety. It was a miraculous run. When it proved to be effective, then that was a good enough reason to have it be immediately licensed, and everyone started to get immunized. And for those of us at that age group, I, along with all my friends, got immunized at that time. A few weeks ago, I wrote an editorial about this in the Pittsburgh Post-Gazette entitled Pittsburgh's Polio Pre-Pioneers, and I told this story in a little more depth. And after I did, Patty Antonucci sent me a note. Many of you may remember Patty. She was the head of human resources here at the School of Public Health and has long since retired. But she sent me a note and she said, "I hope you remember me working for you. I read your article about Dr. Salk. I thought you might find it interesting that the nurse in that picture was my Aunt Louise, who worked with Dr. Salk at that time." So those of us who are Pittsburghers know this is a Pittsburgh story. Hey, that's Aunt Louise. Oh, yeah. A way to think about this is we're here to celebrate Jonas Salk and the laboratory of Jonas Salk. But Jonas Salk surrounded himself with an outstanding team that included Julius Jungner, who was the very first scientist to work with him on polio and continued on here at the university, and was a beloved figure at the university until he died a few years ago. And of course, there was Aunt Louise, and there were a lot of other Aunt Louises around as well. But outside of that, the reason that he was able to succeed was that he was able to draw in the entire citizenry of the Pittsburgh region of southwestern Pennsylvania. That it was the children, the parents, the teachers, the whole community that pulled together, that allowed these vaccine trials to go forward and set the stage for the successful national vaccine trials. So I take pride in being a Pittsburgher. So I hope you all do too. And there's a lesson here as we hear anti-science and anti-vaccines. At that era, at that time, everybody pulled together. There was a real threat that everybody feared. Everybody pulled together, including the community, along with the scientists, and they solved the problem. So I think there are some lessons for us there today. And I hope we can look back at this and build on those lessons to turn this legacy into a living legacy. Thank you very much.
Don, thank you very much for that talk, and I just have to express my own personal gratitude to you for having stimulated this whole idea of bringing these portions of my father's experience in life, his legacy, back to Pittsburgh to make the most we can from this whole experience and undertaking in view of the future. And I want to express my gratitude on behalf of my family, my two brothers, Daryl and Jonathan. The two of them put in enormous amounts of work in this project to help organize, find, identify, and end up delivering this material back here to Pittsburgh. So on behalf of all three of us, I want to express my gratitude for what has taken place. And I also want to pick up on one thing you said, Don, which is this work that we're celebrating and all of the other work that my father conducted during his life. This was not a solo project. This depended on the skill, the dedication, the devotion of all those who participated here in his laboratory, both his research colleagues, the people who were the technicians, who took care of the animals, who helped with the vaccination process, the people of the city of Pittsburgh who rose to the occasion and participated in the project. All of this was a group and a community effort. And I also need to express my own personal gratitude to those people who I came to know, who accompanied my father to California, those who worked with him there, and two people in particular that I would mention: Lorraine Friedman, who was his longtime executive assistant starting here in Pittsburgh and throughout almost all of my father's life, and Barbara Robinson, who worked with him as an assistant in California. And she is responsible for having, after my father's death, where these materials were in all sorts of locations at the Salk Institute and elsewhere, she devoted herself to identifying and collecting and organizing and storing these materials to the point where now they were available to come here. So just many thanks to so many people. What we are looking at right now is, this was the scene on April 12th, 1955, when Thomas Francis, who's pictured next to my father, had helped to organize and design the trials and was responsible for collection of and analysis of the data. When the results were announced, which my father didn't even know until that morning at breakfast, pandemonium broke loose, and we know what has happened since then. My father, after that experience, continued to do work over the years to help refine and perfect and to make more potent the original polio vaccine at the Salk Institute, and starting even while he was still in Pittsburgh. He was interested in how the immune system worked fundamentally and how one could change the balance of it. He referred to immunological paradoxes, two different arms of the immune system. Can we help to increase resistance against cancer on the one side? Can we help reduce the overactivity of the immune system in autoimmune disease? He conducted clinical studies, first animal studies and then clinical studies, on an approach to intervening with the autoimmune disease, multiple sclerosis, and at the end of his life just poured his heart into prospects for an HIV immunogen based on a killed HIV virus that might be able to be used both prophylactically and also in the context of individuals who already were infected with HIV, to see whether the disease could be slowed. A process that there were very interesting findings from that study. Nothing ended up, at least to date, in practice. But this was a man who never would stop. He wanted to do whatever he could. This was his childhood dream. I want to help humanity. He was able to fulfill that in terms of polio, continued to do work in the laboratory, and then in addition, as part of this became something that really consumed him, was thinking about humanity and its future. He wrote 4 books, starting in 1972, Man Unfolding, which Had it been written 50 years later, might have been called Humanity Unfolding, but this was the parlance of the time. The second book was The Survival of the Wisest, which served as a subtext. Don helped to organize on my father's 100th anniversary. He had died 5 years before that, the 100th anniversary of his birth, a Jonas Salk symposium on sustainability, and that was the subtext of the Survival of the Wisest. With my brother Jonathan, he wrote World Population and Human Values, A New Reality, and finally, book Anatomy of Reality, Merging of Intuition and Reason. He talked on this subject. He wrote on this general theme of how can we take our successes and use them to increase the ability of people to get along with each other. We have so many problems that we're confronted with as a species. We're dealing so successfully with many of them, but what we haven't yet succeeded in is knowing how we can relate to each other in ways that will reduce all of the kinds of tensions we're faced with, not only with respect to infectious disease, other sorts of disease, but also the diseases of war, poverty, inequality, all of these issues, the dealing successfully with the environment. We have to be able to come together as a species and deal constructively with each other. That consumed him, and as far as I'm concerned, this is part and parcel of public health and global health, and it's our responsibility to succeed in that aspect of his life as well, his desires for the world. My brother Jonathan, in 2018, redid the World Population and Human Values book, New Reality, Human Evolution for a Sustainable Future. My father, in 1977, when he received the Jawaharlal Nehru Award for International Understanding, asked this very provocative question in his acceptance speech: Are we being good ancestors? I think we want to be able to answer that question in the affirmative. He formed the Salk Institute, founded that in La Jolla, California, after he died at the exact center of the plot where the laboratory buildings were built. This quote from that acceptance speech was engraved in the travertine, which says, "Hope lies in dreams, in imagination, and in the courage of those who dare to make dreams into reality." From my vantage point, looking back, looking to where we are now and looking into the future, let these materials that have been so beautifully handled here and at the library, let these serve as an understanding of what happened back then, what happened during the course of his life, and what we can now do and take on as our own responsibility for the future. Let this serve as an inspiration. And I want to thank you, everyone, again, and just say, my father, with all of the help he had, was an amazing person. And one of his greatest attributes was wisdom, and I think that reflects itself in this book. Thank you.
Well, good afternoon, ladies and gentlemen. My name is Stephanie Yurchik, and in the year 2024-2025, I'm going to be the president of Rotary International. I would like to thank the School of Public Health and the University of Pittsburgh for the invitation to be a part of this incredible event today. So what is Rotary, and what part do we play in the history and in this story? Well, Rotary is an international service organization. We have 1.42 million people of action who look around the world and look around their communities and find things that need to be made better. Well, about 40 years ago, we looked around and we saw polio and decided that this would become the corporate project for Rotary International. We had the audacity and the courage to say, you know, there are 1,000 children every day who are dying
or being paralyzed by this disease, and this is something that we can help make better. Our first polio immunization campaign happened in the Philippines in 1979. And then in 1985, we launched something that we call internally our Polio Plus program. And we raise funds and we raise awareness about the benefits of immunization against polio and other childhood preventable diseases. We are a core partner of the Global Polio Eradication Initiative, which was launched in 1988 and whose members today include the World Health Organization, UNICEF, the U.S. Centers for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and the Gavi Vaccine Alliance. So Rotary has specific roles in polio eradication, and those roles are fundraising, advocacy, raising awareness, and directly participating in polio immunization activities. Personally, I've been on 2 trips, immunization trips with Rotary, one to India and one to Nigeria. To date, through our members, our own members, and our fundraising partnerships, most notably with the Bill and Melinda Gates Foundation, we've contributed US $2.6 billion to the global efforts to eradicate polio. Through our current End Polio Now fundraising campaign, every dollar that is donated is then matched 2-to-1 by the Gates Foundation. Thank you, Chris, for this long-standing partnership. Okay. Rotary is particularly grateful to our frontline workers, such as these women in Pakistan and Nigeria, because these are the vaccinators, the women who go door to door, house to house, vaccinating every child under the age of 5 multiple times every year. Their work is strenuous, their work is dangerous, but without them, we wouldn't succeed in reaching as many children as we do. Women are the key to achieving a polio-free world because of their ability to engage with mothers and they have access to households in some communities, unlike men. For religious reasons, sometimes men cannot go into a house. So these women are vaccinating children inside a home in Pakistan on the left, and the woman in blue is a resident and vaccinator in an internally displaced persons camp in Borno, Nigeria. The result of this massive immunization efforts is that 3 billion children have been immunized since 1988. Today, we only have 2 countries, and you'll hear more about that, Afghanistan and Pakistan, that have never stopped the transmission of the wild polio virus. When we started in the mid-'80s, there were 125 countries where polio was circulating. So far this year, Pakistan has reported 1 case of wild polio, and Afghanistan has reported 0 since August of 2022. Each year, up to 370 million children have to be reached with the polio vaccine so that we can sustain that high population immunity to protect them from polio. And as long as polio circulates anywhere, it's a threat to children everywhere. The most significant outcome of Rotary's efforts and that of our partners is that we are having a positive impact on the lives and well-being of children and their families. Through our efforts to eradicate polio, we've also provided other kinds of health services such as clean water, nutrition, soap, health education. More than 20 million children are walking today who otherwise would have been paralyzed or even would have died from polio. Rotary had the courage, Rotary had the audacity to dream of a polio-free world, and we have the tenacity, together with our partners, to finish this job. And we will keep our promise to children everywhere. Thank you.
Good afternoon, everyone. I must say I'm really humbled to have an opportunity to come and speak on this panel for a childhood hero. And I'm also pretty awestruck today. I never skip to a script, so I'll just make some comments before I go through whatever slides are up there. Let me start by thanking the Salk family for this wonderful exhibit that I hope some of you have seen already or will see. So Peter, you and your brothers, thank you very much. You get these wonderful little books that talk about where people went and where they went to school and where they work. And I don't think it ever really captures the power of public health and how you just heard from Stephanie. You're going to hear from Dr. Chris Elias in a couple of minutes of what they do every day all over the world to make it healthier, safer, more thriving, wonderful communities. So thank them for the public health work that they do. Now to a little bit more of the awestruck part. So when I joined CDC way too long ago, in the time of the dinosaurs, right out of residency, we were already told about who Don Burke was. Dr. Don Burke, this amazing virologist doing amazing work all over the world. And then when I had the pleasure of becoming dean at the College of Public Health in Nebraska, very young college, compared to yours, Don was a good friend and a great mentor. So Don, thank you so much for who you are. And I can't finish the awestruck part without talking about your dean. You have an amazing College of Public Health, 75-year history, started by a former Assistant Surgeon General, amazing alum that have come out of this institution and led by, of course, amazing people. But your current leader is somebody I've had the personal pleasure for knowing for a long time now, well-known in environmental health, climate change. I can go on how well she's known. So well known that she has that rare honor of being a member of the National Academy of Sciences. Your dean, Maureen Lickfield. So I get the fun part now of saying a couple of things about polio now and in the future, and let's see if being a dean does not mean you know how to use these. Is that me? Yeah, that's me. Okay. So when I think of the legacy of Dr. Jonas Salk, two things come to mind for me. One is about scientific innovation and pioneer, and the second is about being a humanitarian. And I think Dr. Peter Salk captured that last part in his last couple of slides. So I just wanted to make the point that the science continues to move as far as polio is concerned. And one of the key ways that the science is currently moving is how we now genetically re-engineer poliovirus so that it's less likely to go ahead and circulate and become sort of more infectious. And so we now have a novel oral poliovirus 2. Dr. Elias reminded me that novel oral poliovirus 1 and 3 are in the pipeline also, because most of the polio cases you read about are usually of what's called circulating vaccine-derived poliovirus. So it's not the normal wild type, it's the stuff that we give people to try to protect them, but it has a little nasty little habit of sometimes becoming hot again and then causing an outbreak. And so some of this new science is to keep that from happening. So an example of how the science continues to move. The other way the science continues to move is something that you saw yourself over the last 3 years of the COVID pandemic, right? So I'm sure many of you heard about wastewater surveillance and checking wastewater to see whether there's SARS viruses in that. This is old tech, right? We've been doing it for a very long time, mainly for poliovirus, but now they're doing it for everything. You know, I think I probably have a long list of things here, including illicit drugs, environmental exposure. So again, sort of this how we've sort of built on that legacy for the next, reiterated for what is the next set of science going to look like. And so we'll see a lot more of wastewater surveillance moving forward to try to understand what's going on within our communities, not just for these viruses that are gut viruses, but also for viruses that are respiratory viruses and antimicrobial resistance. This goes to the legacy of Dr. Salk and all of the wonderful work done by Rotary and done by the Gates Foundation and WHO and so many other global partners, is a wonderful slide like this where you can look at this and go, wow, right? None of you woke up today worried about smallpox, right? God, please hope nobody woke up worried about smallpox, except for maybe the one virologist out there. And I hope we are soon to a tomorrow where nobody's going to wake up worried about polio. And if we keep up this pace, we will be on good track to continue to protect our children against diseases that have been scourges for so long. However, I think we need to admit that preceding the pandemic, but definitely accelerated by the COVID pandemic, there has been a polarization within our community that unfortunately has had a sort of a backlash against public health and the role of public health. So we've gone from when people couldn't wait to get that polio vaccine, right? Couldn't wait to get the vaccine to, well, do I need to be vaccinated at all? You know, that is not good for public health, obviously, and for what we expect for our children. And I think this, to me, this last piece is about how do we protect this legacy of Dr. Salk, especially here in Pittsburgh, where many people signed up and said, hello, right? I want to be there as a pre-pioneer to make sure we can protect the world against polio. And so how can you continue to serve that role is help be a beacon for the rest of the United States and the world on why vaccines are so important. And here I'll give you two examples right here in the United States. Most of these hit the paper, so many of you may have seen it, right? Paralytic case of polio in the not wild type polio, again, it's that sort of vaccine-derived polio that probably made its way over from the Middle East. But, you know, a case of polio here in the United States, right? That shouldn't have that, right? Everybody should be vaccinated. There should be no risk of somebody getting polio in the United States in this year and this time. And we just finished up an outbreak of measles in Ohio. Exact same thing, vaccine preventable diseases. Our children should not be at risk for measles anymore. So this is the legacy of Paul Salk that we need to continue to make sure that our children remain protected from these vaccine preventable diseases. Thank you, everybody.
Thanks, Ali, for doing such a good job of thanking all of our colleagues on this panel. It's been great to sit and listen. I could just second your great comments about how wonderful everybody has been in their presentations today. You know, in 1955, the University of Pittsburgh stood on the precipice of an important historical event. And I think we're about there again, actually. And that's just one of the reasons I'm excited to be here on the 75th anniversary of the school and to celebrate with all of you and to honor the work of Jonas Salk, because the journey I'm going to talk about, which is what I think is the final mile of eradicating polio from the world, really began here with the development of the first polio vaccine that was licensed in 1955. We've heard some of this before, but I want to just give you a sense of that history. Polio is a very old disease. You can look at 5,000-year-old hieroglyphics in Egypt and see pictures of people who had the withered limb that is characteristic of somebody who's been paralyzed by polio. Just to give you a sense of the crisis that America was facing in the 1920s, 30s, 40s, before there was a vaccine, we saw rising levels of polio in this country. In 1952, just 3 years before the Salk vaccine was licensed, there were 60,000 cases of polio in the United States. Most of those people had some permanent paralysis, and 3,000 of them died that year. President Franklin Delano Roosevelt was stricken with polio in 1921 before he became governor of New York and ultimately president of the country. He played a big role in creating what we came to know as the March of Dimes and the initial efforts to respond to and care for people who were hit by polio in this country. Because in the absence of a vaccine, polio is very, very contagious. As Ali said, you know, until it's gone, everybody's at risk if they haven't been vaccinated. So like 1928, these are wards. You saw a picture of this earlier in bigger form. Wards of people who couldn't breathe, and so were in these iron lungs. And there's one of them downstairs in the exhibit if you haven't seen it yet. Obviously, the licensing of the Salk vaccine in 1955 and a subsequent oral attenuated vaccine by Albert Sabin in 1961 gave us the tools that we needed to provide people with immunity against polio. And sure enough, the last case of transmission of polio in the United States was in 1979. And then with the leadership of Rotary, the World Health Organization came together, the 194 nations of the World Health Organization, and in 1988 declared the goal of global polio eradication. There was 3 types of polio, there were 350,000 cases, and they were in over 125 countries. And I'll get back to the new vaccine that Ali mentioned, the novel oral polio vaccine, which has given us a tool for our final mile. But just to give you a sense of our progress, after the World Health Resolution to eradicate polio in 1988, where there were 125 countries with polio transmission, most countries made rapid progress. By the year 2000, we were really down to a handful of countries. But that tail is long because, blowing it up, there's really just been a handful of countries where, because of poverty, poor sanitation, often conflict that limits access to children. One of the worst things about war is the inability to reach children with life-saving treatments and prevention like vaccines. So you've seen, we've been making steady progress. As Stephanie said, we've had only 1 case of wild polio virus anywhere in the world in the last 6 months in Pakistan. Had a few environmental samples, wastewater samples positive in eastern Afghanistan, but that's it for the last 6 months. So we may be in the last year of wild polio virus in the world. Now, only one other disease has been eradicated from the planet, and that was smallpox, which was certified gone in 1980. You did see the purple line there on the right. We knew with the Sabin vaccine that even in the early 60s that there was a risk, 1 in a million risk, that it could revert back to virulence. We didn't discover until 2000 that when that happened, it could potentially transmit in populations with very low immunization coverage. And so today, as we're reaching the final line in eradicating wild poliovirus, we're seeing that there's actually more cases from this vaccine-derived poliovirus, and that's where the novel OPV comes in. As we deploy that, I get this picture once a week as the chair of the Global Polio Oversight Board. And this is the last 6 months. You see the one red dot in Pakistan is the only wild poliovirus case. These green and brown dots are cases of vaccine-derived poliovirus. Green is type 2 and orange is type 1. And if I had shown you this map from a year ago or 18 months ago, it would be covered with many more dots, because as we're now rolling out that novel oral poliovirus, which was just licensed or under an emergency use in late 2020, that's our tool for getting rid of that problem. But I want to talk about how we finish the job on wild poliovirus. We have to do a few things. We have to find the virus. There's 2 ways we do that. One is we find paralyzed children. We have an army of frontline workers. This is Stephanie's point about the most essential thing in the polio eradication program are those frontline workers, 80% of whom are women, and who are out there in some of the toughest communities. We try to find every case of paralysis, and then we test them to see if they have poliovirus. And because in order to say the world is free of polio, we have to be able to be confident in our surveillance system. Fortunately, if we find all the paralyzed cases, there are a number of children who become paralyzed for other reasons. So if we're finding no kids with paralysis, we're not doing a good enough job of looking. But if we find them, those kids, about 2 in 100,000, who are going to be paralyzed from Guillain-Barré or some other cause, often temporarily, and test them, and we don't find the wild poliovirus, then we know it's gone, or vaccine-derived. The other is the importance of wastewater surveillance. We've greatly expanded the amount of wastewater surveillance that we've done, particularly in these last frontiers. Then we have to do detailed planning, and this is where we're using really some of the cutting-edge tools of geospatial mapping, et cetera, to give those frontline workers who are going out into communities accurate maps to find the households, especially in some of these peri-urban informal settlements. It's important to know where the children are. We did this in the final stages of polio eradication in Nigeria 5-10 years ago. We actually mapped where the polio cases were, and they were on the district barriers. They were literally falling between the cracks of the polio teams. So we had to then give them better maps so that they could cross over and get people on the other side of the street, even if it was a different district. And then we have to vaccinate through every means. And this is, a poor set of pictures because it's too small. But the things that these frontline health workers do in snow, in floods, in rural, on bicycles, on foot, on motorcycles, often in very difficult environments. These are the real heroes, are these frontline workers. And then I won't go into this in great detail, and I'll leave time for our discussion, but this is just some of the benefits of our new innovative tool, which is a critical tool for getting rid of those few vaccine-derived polioviruses. Our goal is to get rid of them all by the end of this year. That will depend on being able to get into some very difficult geographies like northern Yemen and Somalia and places where conflict is currently preventing us from being able to reach children in the final mile. But once we do that, we know the vaccine works. We've been using it. We've given it to 600 million children in the last 3 years, last 2.5 years. And it's working. We just have to get it to all of those children. So as that weekly map I get shrinks, it increasingly gets concentrated in what we call the consequential geographies. Nice word for very difficult places with very poor access. So with that, let me stop here and turn it back over to our discussion, I think, right? Thank you. Here.
So what we will do now is begin our panel discussion by asking each of our panelists to share a bit behind the story case. And let me begin with Dawn. Dawn, must have not been easy to do a children's trial in 1955. Not only did it happen effectively, but it happened so quickly. So could you share a bit behind the scenes what happened in 1955?
There are two levels here. The 1954 Pittsburgh trials to set the stage, and then the large national trial of 1.8 million people. The trial was organized and supported by the National Foundation for Infantile Paralysis. That had the backing of the former President of the United States, Franklin Delano Roosevelt, when it got started. But the driver behind that was a named Basil O'Connor. He was a law partner of FDR's. And when he started the National Foundation, he was well connected. He knew everybody. He knew everybody in DC. He was famous for wearing a carnation in his lapel and being a man about town. And so the question was, how could you mobilize the money and the resources to pull this off? Well, what they did was, amazingly, they got almost everybody to volunteer. They actually spent very little money on the actual conduct of the trial. One estimate has there were about 300,000 people who volunteered to make the trial run. These were all done in the schools. That there were first, second, and third graders all across the United States. And in every case, it was the teacher helping organize the schools, nurses coming in, vaccinating at the school site itself. So the logistics were very efficient. And the funding was pretty, I won't say minimal, but when you're doing 1.8 million children, it takes a fair amount of resources, and the National Foundation pulled it out. They were able to get some manufacturers. One of the things that Dr. Salk did, which was probably one of the most difficult things, was to take his technology, which he had developed here in Pittsburgh, and then transport that to several manufacturers so that they could make the vaccine safely in their facilities with the appropriate safety testing. So, and some of the things that I've read, that drove him nuts. The idea of trying to have people, because they said, well, we know how to do it better than Dr. Salk does, and we'll make a modification here. But he was, one of the things he rode herd and made sure that the vaccine was safe. So all of those things. bringing together the volunteers, bringing together the financing, make sure the technology was straight. I think it was nothing short of a miracle. And as I said, I'm amazed at his, not only the scientific brilliance and his attention to the human side of the equation, but his organizational genius.
And we're so honored to have some of those pictures in the hallway showing all the kids. So speaking about money, Stephanie, so why is Rotary International still investing in this if we only have one case?
Well, basically because it's a promise that we made to the world. We made a promise to the children of the world, and Rotarians are not going to go back on their word. That's the easy answer. The difficulty that we find ourselves in right now in this country is that it's a tough sell to talk about polio, because most people, I'm looking at all these young faces, you don't know anybody that has polio. You don't know anybody with post-polio syndrome probably, but people my age do. But remember, Rotary is an international organization. So we're in over 200 countries. So there are Rotarians around the world working in countries where they've had polio recently. So in those places, it's not as tough of a sell. But in this country, we just remind people what happened a couple of years ago in New York. When that case of polio showed up in New York, every one of us who have children or grandchildren or any young person should have paid attention to that and really became seriously concerned about that, because as you've heard all of the panelists say, if it's not gone everywhere, it's not gone, period. And we don't want any child in the world to have to suffer from that incredibly crippling disease that can also kill.
Ali, what's our problem in public health? How can we increase the confidence in vaccines again, as we had it up until 3 years ago?
Do you want me to solve the whole political problem? Right here. I'll be glad to, Dr. Lichtfeld. We can do anything in public health. There's no doubt about it. I think so. Let me preface that. So I'm sure everybody has heard the phrase, avoid it like the plague, right? There's a reason you avoid it like the plague. You don't want to get the plague, right? Because you die. This is the first time ever in the history of mankind that a plague showed up and some people said, you should go out and get infected, right? That's a Great Barrington Declaration, if anybody has heard that. That was then most recently, we saw the Florida Surgeon General come out and say, don't get vaccinated against COVID because you're more likely to get heart disease than if you don't get vaccinated against COVID because it's more likely to cause heart disease. No, COVID vaccine is more likely to save your life than it is to cause heart disease. So I think, to me, this goes to, we say public health, and I think for a very long time, public health has been invisible, and we've loved being invisible. We want everybody in our communities to go about their lives from the day they're born till the day they die, protected by public health in every way, shape, and form, and you don't know who we are. That's a mistake. The first time you see a public health person should not be when he or she gets up on a podium and says, wear a mask. That should never be the first time you see public health. You should be, oh, that's Julie. Yes, she's been talking to me my whole life. She's a little crazy sometimes, but I'm going to do what she says, or I'm going to do what he says, because it's the right thing. They're always there to protect me. I think public health needs to be more visible, and I think we need to put the public, emphasize the public part as opposed to the health part. Right? What is our relationship with the community so that we have more community advocates that say, these are our public health people. We trust them. We want to work with them. And it's harder for public health. We're all about you not getting sick. So it's a lot easier if you have a disease to be an advocate for the disease. It's a lot harder to be an advocate for something you never had. And that's why I love Don's idea of, how do you have that legacy of Dr. Salk to say, hello, how about diseases we don't have, and we are going to be community advocates for public health.
So building on that, why don't we just not stop at containment?
I wish
Is that
we
not
could.
good enough?
The challenge is, if you look at the Global Polio Eradication Initiative now, the annual budget is about $950 million. That includes activities in 55 countries, right? So it's not all in Pakistan, Afghanistan, although those are the biggest expenditures. And that's because until, to Stephanie's point, until it's gone, it's not gone. And so you have to protect the world. If we were to, we have modeled, if you went back to just, say, okay, we got close, but we're done, those maps would start going the other way. You'd have more and more dots. Current models estimate that at current rates of routine immunization, you'd probably wind up with 250,000 cases of paralytic polio around the world. It would be mostly in poor countries, poor communities, countries with high levels of vaccine resistance. It's just, it's hard to think that, it's not like you could just say, okay, we're just going to stop here and it'll stay this way. It'll go backwards. So, at this point, fortunately, Rotary made a promise they're not going to break. And I would say, the Gates Foundation's with them. We work very, hand in hand with Rotary. Having come this close, I actually think the eradication of polio will do a lot to reestablish faith in the institutions that have been weakened during this turbulent time of COVID. It'll be a historic accomplishment for public health. It will protect people from not having to wake up and worry about polio like they don't wake up and worry about smallpox. But it'll also have, I think, a positive externality in terms of helping to reestablish that faith in public health institutions and protecting the health of the public. So, sometimes people say, oh, it's so hard to negotiate access with the, authorities in Kabul, who are doing a lot of crazy things, or to, work in these very, dangerous parts of Pakistan. But it's not like we can freeze it where it is. It's a choice about finishing the job or going backwards, to a pretty poor state of health inequity. And I don't think it's a world that most people want to live in.
And that's what we want to do in public health, is achieve that equity. Peter, your dad was about the people. Yes, it was about the vaccine, but it was about the people. Share that vision.
Well, I think it's what's so nice about what you have done here, having these materials on display to allow this current generation to have a direct experience of what it was that happened and what it was that drove this team that created that first vaccine. It's useful to be able to understand the generosity, the generous spirit, the life-saving spirit that was behind that. So I think that it's what strikes me about this whole experience, the display here and in the library, is that it now has this in a form that people can access. People can take away the spirit of this program that was so successful. And I may be diverting a little bit from what you're asking, but just to say that we have the opportunity now in the future to be handling so many different public health initiatives and to be visible in that way. And to have the current generation of students that are coming through, each person is going to have their own predilection, have their own special field of interest, but for everyone to feel the encouragement that this is something I can do. This is something that we can do together, as has been done. Here's the demonstration of that, and that we can have the courage to take on these major issues that lie in the road ahead, and to help lift our own banner, lift our own stick to do what we can do together with everyone else to overcome all of these difficult situations that we're still facing in the world.
I couldn't have said it better. So we have an opportunity for a few questions in the audience for any of our panelists. Yes, please.
Dr. Khan, you made quite a good point about the difference between COVID now and polio then, and how we as a nation responded. Clearly, we're much more polarized now, and I like polarization spreads out lots of things. But you wonder if the major difference between polio
Former dean of the school before me.
was children versus us old folks of my age who were at risk, and that is part of the reason that there is this
So for the audience on live streaming, before I do anything else, I stand on the shoulders of giants like Jonas Salk, and giants like two emeritus deans, Dean Burke and Dean Goldstein. And so Dean Goldstein asked the question, well, is it the difference between who is at risk, children for polio, adults for SARS-CoV-2, is that the difference why we have this lack of confidence or diminished confidence in vaccines? Dean Khan.
So there's no doubt that equity is a big part of that. So the polarization existed, and it probably, regardless of what political party it would have been, somebody would have tried to spin it to look like it was the other party's fault. But there's no doubt that when a disease goes through long-term care facilities of people who've already been out of mind, out of sight, or it goes through communities that, let's be honest, it was our essential workers, right? It was the people who had to take the bus, the people, excuse me for cursing, I could stay at home, be in front of my computer throughout the pandemic. I could teach my classes. I could manage my faculty. I was in a very different position from somebody who had to get up in the morning, had to go get on a bus, had to go show up at Walmart and see 1,000 people that went through the store every day because somebody had to be essential workers. Well, that was a real different equity issue. And you're absolutely right, Dean Goldberg, that because it didn't affect kids, or if this had been during the 1918 pandemic when we were seeing young adults affected, I think the response would have been different. So equity definitely played a role in that.
Can I just add to that?
Please.
In coming here, I reread some of the history of polio in the United States. What's interesting is I looked at what the US was doing in the 20s, 30s, and 40s, where they had a growing problem. They didn't yet have vaccines. What they had were non-pharmaceutical interventions, the kinds of things we've debated. Quarantines, closing swimming pools, closing movie theaters, restrictions on movement into, trains wouldn't stop in certain cities. And these were not easy decisions, especially in the 20s and 30s when there was still some question about whether it was a respiratory pathogen or an enteric pathogen. But when you read the history, what's different is that it didn't become that political. These were heated debates. Should we close the swimming pool? Fortunately, polio came in the summer, so they weren't having to debate about closing the schools very much. But there was some pushback. The March of Dimes liked to use FDR's birthday as their big fundraiser. There was a Republican who said, look, I'm all in for polio. I just don't want to do it on FDR's birthday. That's partisan. That we can put up with that. But the way that things like masks use, vaccine recommendations, got polarized by politicians, not just in this country. I think if you look globally at the COVID-19 response, some of the best prepared countries, the US, the UK, had some of the most excess mortality that was preventable. The best responses were where they followed the emerging science, and the science emerged. We didn't understand it at first. Things changed. The same was true with polio in the 20s and 30s. But what the US didn't do then was make it an overtly political issue. It was certainly lots of differences of opinion and heated debates about whether the swimming pool should stay open or not, or whether the train should stop at your city. But it wasn't this political polarization, this excessive partisanship that we've seen. And in other countries that have had that, like Brazil, they had a lot of excess mortality as well. So I think we need to, really and this is where I think public health practitioners have an important role to play, is let's have a spirited debate about the emerging science, but let's keep politics out of it.
If I can follow on that, if I may. So public health policy is a function of good science and politics, right? And if you have only politics, you get in trouble. If you only have science, you'll get in trouble. You have people, I'm sure the public health people say, hide under your bed so that you're at no risk for anything. However, the word polarization doesn't come into that. And it's the polarization that gets us in trouble. And I think it's incumbent on all public health practitioners to remind everybody else that we don't lean liberal or progressive or Democrat or Republican. We want to save your life no matter who you are. And I think that's something that we may need to remind ourselves, because we are always out there as advocates for reproductive justice and all sorts of other things. But to remind people, we come from a place where everybody matters.
So we have 2 more questions and then we'll transition. Dr. Dupree.
Ask, in the era of social media, do you even believe that what you said?
It's possible, it's harder. Rumors have occasionally, tripped us up in polio eradication. Northern Nigeria in the early 2000s, there were some rumors about the vaccine, its safety, whether it was made, whether it was going to sterilize people. Those rumors in the early 2000s spread by the word of mouth and by DVD. People handed around DVDs with these conspiracy theories. Now, with social media, which is easily weaponized with malicious chatbots and other things, it spreads fast. So I think it's possible, but we're going to have to really up our game in terms of how do we get the facts out in a compelling way and to fight some of this disinformation. The World Health Organization talks about that the pandemic was accompanied by what they call the infodemic, which is this, rapidly spreading outbreak of misinformation that has just confused people about the emerging science.
Does public health need to change from activists, from advocates to activists? I think we are both all the time. And in fact, I would like to say right here in our school, in our Department of Behavioral and Community Health Sciences, there is science going on about anti-science and misinformation. So we bring it all full circle here. One last question. There was a question in the back.
Oh.
Okay, go ahead.
Nuns marched us all down the principal's office. We all got a shot. They told us it was for the polio vaccine. 2 weeks later, they gave us another shot. Then they gave us a letter to take home to our parents, which said, you won't be told for a year whether your child got the real vaccine or a placebo. Then they announced it a year later, and the nuns told us the vaccine worked. We all cheered like crazy. We got a letter. My letter said that I got the real vaccine. Ever since then, Dr. Salk and his whole team have
There was a real debate at the design of the trial. Should it be a trial of observation where you vaccinated people and only gave out the real vaccine and no placebo vaccines, and just then compared the kids who got the vaccine to those who didn't get the vaccine, an observational control set? Or should it be a placebo control trial? And there was real fighting in the National Foundation about whether or not that should happen. So they ended up with sort of a hybrid. They had some areas that were observational and some areas that were placebo controlled. And that's one of the reasons it ended up being 1.8 million, because they had to do twice as many kids as they thought they were going to have to do.
And so science works for our communities. And I know there are others in the room that were children at those times. So we really want to honor all of those that were there. I know you've been very patient in the back, right there, with your hands up, please. That will be our last question. Can you speak up a bit?
So, the question was about gender equity, given that many of the frontline workers are women. So the Global Polio Eradication Initiative has developed as part of its current 5-year plan a very explicit gender equality strategy, so that we're tracking how to recognize and to support those women health workers, how to recognize what they need, both in terms of their safety and going out to sometimes very, unsafe communities. One of the things we've done recently in Pakistan, the partnership has actually been convening focus groups with the women frontline health workers to make sure we understand their concerns, the challenges they face in terms of transport, the safety in transport, whether they're being compensated enough for the work in order to be able to get public transport, especially in places where transport may be hard to get. So I would say in the last 5 years, the global program has become much more intentional about its gender equality strategy. I think what it's showing us is we have a ways to go. Because I think if you go back, I remember when I first started working in polio about 12 years ago, raising the question of gender equality and being told, well, they immunize all the kids, whether they're boys or girls. But when you actually look at how the program works and its dependence on those frontline health workers, you realize there's many other dimensions to gender equality beyond the fact that we're immunizing infants no matter what gender they are. And I think that's actually helped us to improve the quality of the program and the safety of the frontline health workers, et cetera. So thank you. It's a good question.
And we, of course, in public health, see equity not only as health equity, but equity in a number of other areas, poverty and transportation and access to care. And so our work has just begun. We have a long way to go, and I couldn't agree with you more. Please join me in thanking our panel members as we transition.
All right. I wish we could continue the questions, but we also want to move forward to celebrate the unveiling of our exhibit and then get to the reception where we can all mingle and talk a bit more about this important topic. Again, thank you to all the panelists here. So I'm Jessie Burke. I'm Vice Dean for the School of Public Health. I am also daughter of Don Burke. So I have been hearing about Jonas Salk for my entire life and was fortunate actually as part of a high school journalism assignment to interview Dr. Jonas Salk for that assignment. I got a C, and I think it was actually because I didn't do a very good job on the assignment. It was not any fault of his. And so I hope that what we're presenting here today is a slightly better version of that work. So again, I'm very excited to be here. It has been a long time coming. You heard a little bit about the discussions that have happened more than a decade ago in terms of that the materials, when Jonas Salk left here and went to La Jolla, he took several of his lab equipment and papers and many other documents with him. And then just this fall, we were able to bring them back. And so over the past several months, it's all a blur because it's really been crazy. We have been working really hard to pull these together into an exhibit that is on display here on our Fifth Avenue entrance and as well up in the Commons area. And so this has really been a team effort. I have had an absolute pleasure doing it. This has been a combination of people from the university library system, museum studies, public health here, university communications, and public health professionals as well. It has included, as you heard earlier, from 2 students who have been involved. They have been working with Don Burke, going through all of the boxes, and several other students, faculty, and staff. And so I just want to pause here and really say a sincere thank you, if we could give them all a round of applause. And so we are particularly grateful to the library system, and what they have been doing over the past several months is cataloging all of these paper products and documents that have come. That includes serum cards, that includes handwritten notes from Dr. Salk about his time and his transition to La Jolla, and that is all now available through this collection guide. So you can go here, you can use the QR code and search through and see what's available in the collection, and then you can arrange to go see it actually at the Hillman Library. And so this is a huge effort, and again, thank you so much to the library for pulling it together. All right, so what we have on display is really about the development of the polio vaccine, but as Dr. Peter Salk mentioned earlier, there is a long history in terms of his father's legacy and work, and our hope is that in the future we will be able to put additional pieces in our exhibit. So stay tuned for more, but let's celebrate what we have here today. And what we're gonna do is we're going to have an official ribbon cutting. We're going to do that here as a ceremonial piece before we go out into the display area. But before we do so, I'm very excited to share that Dr. Elias has generously contributed an additional item to the collection. You want to speak a bit about that?
Thank you, Jesse. So it was just such an honor to be invited to come and participate in this event, the opening of the exhibit, and the 75th anniversary of the school. So I want to tell you the story about I want to make a contribution to the exhibit to complement the great things that the Salk family has given. So in 1955, after the vaccine results came in and the vaccine was licensed, Jonas Salk was awarded the Congressional Medal of Honor by the US Congress. And I did a little research on this, and it's fascinating. I would encourage you to look at the Congressional Medal of Honor website. It's actually probably one of the country's greatest honors because it's rare. There are many presidential medals of freedom. That would be nice to get too, but the president decides on giving that. In order for someone to receive the Congressional Medal of Honor, 2/3 of the US Congress has to vote to pass a law to award the medal. So that was awarded to Jonas Salk in 1955. And then after that, the US Mint actually created a number of bronze replicas of the Congressional Medal of Honor, which has a picture of a woman protecting 2 children holding the medical caduceus. It has a picture of Jonas Salk on the back. And the history of this replica is that it had been circulating slower than the polio virus among the Rotarian community. And about 8 years ago, Ezra Tashomi, a Rotarian in Seattle, at an event, gave it to me and said he had been given it by another Rotarian who had been given it by another Rotarian. And he said, when you find the right person, pass it along. So coming here and seeing the tremendous exhibit that the library and the university has put together with the incredible generosity from the Salk family, I thought there couldn't be a better place to pass along this bronze replica of the Congressional Medal of Honor that Jonas was awarded in 1955. I think going back to our panel, it's a sign of how much the country was waiting for this vaccine and how what at the time was, pretty equally divided Congress came together to say, this is a remarkable achievement. If you look back, the first Congressional Medal of Honor went to George Washington. Probably 60% of them have gone to military figures. But it's relatively rare for a civilian to be awarded this highest honor from the US Congress. And I think it just speaks to what one of the questioners was saying about how the country came together around this life-saving public health intervention. And so very happy to contribute this little piece to the incredible exhibit that you've put together here at the University of Pittsburgh. Thank you.
And so actually, we're going to ask you to stay up here for a photo, and because we have a surprise gift for you.
Oh.
Yes. So why don't we first do a photo?
Okay, go ahead. There's the photographer.
Thank you.
What an honor.
Don't break
And
it.
don't break it. That would be me breaking it.
It's bronze, it's hard to break.
Right. And
So let me get at the podium. In reciprocating a gift, that we can't have you leave here without taking away a little bit of the Jonas Salk legacy.
Oh.
So in the collection, there are reprints of most of his articles that he wrote while he was here at Pittsburgh. And most of these, we have boxes. We have, so we're not just giving you precious one-offs, I'm sorry. But we did put together a collection of reprints that were from his personal collection of all of his important papers that were done here at the University of Pittsburgh in there. And so this is for you as a gift. Okay, good.
Thank you.
All right, so now to the ribbon cutting portion of the event. So I'm going to invite Dr. Salk, Don Burke, Galloway, and Lickfeld to the front of the room. And we are going to put across our little, thank you, Jill and Jen.
Okay.
We have gotten these wonderful scissors made that actually mark the moment as well. I'm going to hand them.
No.
This is great.
We're just fake cutting. You're the actual cutter.
All right, I'd like
We don't actually cut.
have to follow instructions. All right, so 3, 2, 1.
Very good.
All right, so I'm very pleased to announce that the Jonas Salk Legacy exhibit is now officially open, and it's time for us to head to the reception. So if you want to take a look at it on your way out, you can come and enter or exit through these doors and then go upstairs to the Commons. Thank you all again for coming.
Great.